Welcome to Homefront on County Cable Montgomery. I'm Mike Subin, representing Montgomery County's Commission on Veterans Affairs. Homefront takes you inside the stories of Montgomery County's veterans. We often talk about our veterans and how their service impacts the rest of their lives. We also talk about the way they can be helped. Today, our very special guest, and we're honored to have him, is Michael Heimall, who 1 year ago was named Director of the Washington, D.C. VA Medical Center. Michael is a former Army officer who worked as director of the Walter Reed National Military Medical Center in Bethesda from 2015 to 2017. Michael, welcome, and thank you so much for taking the time out of what we know is an extremely busy schedule.
Thanks, Mike. I'm very happy to be here.
Michael, outside of the hospital, what other medical services does the VA offer?
So I think it's important to think of the VA as a comprehensive health plan. Much like you would view Kaiser or other large healthcare providers that also have health insurance packaged with them. And so most people think of hospitals and medical centers, but we offer a full array of outpatient services. And to include in the DC Medical Center, we are a heart center, so we have cardiology, we have cardiothoracic surgery. Additionally, in those outpatient services, we also operate a 120-bed nursing home, a community living center that is available for veterans in our area. And we have
Is that the one at on the Eastern Shore?
No.
So it's not Charlotte Hall.
Charlotte Hall is actually operated by the state of Maryland. We have one co-located on our campus in the district.
Sorry for interrupting you on that, but I may ask you a related question in a few minutes. Now, you made the analogy to insurance companies like Kaiser and Blue Cross or whatever. Does a veteran need to have an insurance policy? What would be the fees?
Well, that depends on what their eligibility ratings are and what their service connection is. A veteran who has 0% service connection might have some co-payments for services at the VA, or they may have services that they need that wouldn't be covered by the VA if we had to send them to the community. And so it's very important for veterans who have questions like that to talk to our eligibility specialists.
Now, you talked about cardiology and some other specialties. Is that across the board, or do you have to send the veteran out somewhere else, maybe to take care of some renal issues?
We can provide renal issues, and we have a large dialysis center at the medical center. The only service that we don't provide directly in the medical center is neurosurgery. Our partners at Baltimore, the Maryland VA healthcare system in Baltimore, provide neurosurgery, and we also collaborate very closely with Walter Reed National Military Medical Center for neurosurgical services.
So I think it's important for a veteran to know that if they can't get the services that they need at the DC Medical Center, there's one not that far away that they can go to get those services. And so they're not struggling maybe to have to travel far or whatever.
Absolutely, and we work both with Baltimore as well as the Martinsburg VA. And then we collaborate very closely with our partners in the Department of Defense at Walter Reed and Fort Belvoir Community Hospital in Northern Virginia. And then we have a large network of community providers that we can rely on.
Now, we talked about 121,000 beds or patients that you've served. How many veterans are there in the area that could be served?
Our numbers indicate there's about 250,000. Many are like me and retired from the military, and I have access to the Department of Defense should I choose to go that direction. I choose to get my care in the VA Medical Center, and so I am almost completely reliant on the VA for my health care.
So if somebody were able to get an outside provider, like you said, Kaiser, Blue Cross, why would they enroll in the VA system?
I think there's a number of things that we do differently in the VA healthcare system that is not done in American medicine. We closely manage care of veterans who come to us and coordinate that care very closely among the providers that we see. I think in the VA, when you look at issues like opioid prescribing and opioid use, we're 10 years ahead of where the private sector is in recognizing this problem and putting strategies in place to really minimize the exposure of our veterans to opiates.
Well, I think that's fantastic because it's only been relatively recently that the public sector has recognized the extent of the problem.
Absolutely. And the VA and Department of Defense have been working on this since 2007.
So what that really says to me, Michael, is that there's a lot going on behind the scenes to provide specific care to veterans that isn't apparent, that the public sector hasn't caught up to, but yet our veterans have access to services to address those problems.
Absolutely. And our ability to coordinate homeless programs and financial insecurity of our veterans and the impact that has on their health status is something that a civilian health insurance plan wouldn't necessarily put programs in place to address.
Right, and most of the homeless don't have access to those programs. We've participated in program Homelessness 2016 to what they call functionally eradicate homelessness among veterans, and it means that at a point in time survey, we count the number of homeless veterans, and there's a factor that's multiplied by, which means can we provide access to care for every one of those who might need it. In a recent coup, the VA Washington Hospital Medical Center located a community-based outpatient clinic here in Montgomery County, which is one of the greatest accomplishments that we've had. Could you tell us about that?
Yes, it's located on Gaither Road. It's been open just over a year. It opened in September of 2018. And the first two providers that we hired there are women's health providers. They are physicians who have experience in dealing specifically with women's health issues. And so they can see both male and female veterans at that clinic. And we're now looking to begin to expand our services there to have our cardiologists and our urologists come out on a part-time basis. And we have an agreement with Walter Reed where their gynecologists will be coming out so that they can treat female veterans closer to home.
Well, I can attest to the fact that the women at the CBOC don't just treat women. I think all my providers there have been female doctors, and I'm really pleased with the care that I get there.
And in all of our community-based outpatient clinics, we also have a licensed behavioral health provider who can see patients that are impaneled to that clinic and coordinate with their primary care managers. We also have dietitians there and a clinical pharmacist.
I think it's important to note, too, that for those of us who have PTSD, there is a psychiatrist at the CBOC who treats only PTSD.
Yes.
That's it. And get an appointment early, folks, because it takes about 2 months to get in to see her, but it's well worth it. Michael, in a recently announced major development, and you talked about individuals having to go for outside services, the VA announced the Mission Act. And could you tell us about that, and including the eligibility requirements?
Yeah, the Mission Act took effect on the 6th of June of this year and is really designed to allow us to operate more as an integrated health system and rely on civilian providers where we don't have the capacity to see veterans in a timely manner, or when it may be a long commute for the veteran to get to healthcare services. And so from an eligibility standpoint, veterans have to be seen within the VA healthcare system within the past 2 years and have a referral to a community provider. Those referrals are handled through our community care office, and normally what happens is your primary care provider will put in a consult for you to see a specialist in the community, either because we don't have the service available, we can't see you within 20 days for primary care or behavioral health, or within 30 days for specialty care, or we're outside of a 30-minute or 60-minute drive time from where the veteran lives.
Now, earlier you went through the services that you provide and that there are certain services that you don't, but you partner with Baltimore. And now you have the CBOC. What are the chances that a Montgomery County veteran is going to need to take advantage of the Mission Act?
In terms of seeing a community care provider, there are a couple of services right now where we can't meet timeliness standards. Great example is gastroenterology. For those of us who are over 50,
I don't know anything about that.
Services like colonoscopies, there's quite a backlog, and we could leverage community providers to help provide those services to our veterans in a more timely fashion.
So if I were to go to the CBOC and say, I am having these stomach problems, I need to see a gastroenterologist, and they say, well, you know, we can provide you one at the DC Center, but you're going to have to wait for 3 months. And I say, I'm having these horrible stomach pains, nausea, I can't eat. I can't wait 3 months. Now what?
So the provider has a choice, and you have a choice as the veteran. You can, they can try to get you in to be seen by one of our providers at the medical center sooner, and we do that all of the time, particularly for somebody who has symptoms of a more serious disease. Or you could request to go to a community provider, in which case your primary care provider would put in a consult, and within 3 or 4 days you would receive a phone call to be scheduled.
So what that says to me is that a veteran in Montgomery County who wants to take advantage of the system is going to be covered by the VA no matter what, whatever their symptoms are. And if it's not at the DC hospital or at Baltimore, or you need to see a provider sooner, there is now a way, which wasn't before, to do that.
There is.
That is fantastic, and I think it's important for our veterans to know. Michael, we're running out of time. I think we could do 3 sessions on all of this. I know the interest in the county veterans community about health care. And right now we're working on getting a seniors home like at Charlotte Hall. So thank you very much for taking the time.
Thank you.
Every show tries to bring you another look at the people who've been serving our county and country. I want to thank our special guest, Michael Heimall, for taking the time out of his busy schedule. Again, Michael's director of the Washington, D.C. VA Medical Center. I am Mike Subin, and on behalf of the Montgomery County Commission on Veterans Affairs, I want to thank you for joining us. Thank you.